In 2024, there are surgeries meant for diabetes. These are surgeries for diabetes. There are hundreds and thousands of patients who got operated for diabetes and obesity, and today neither is obesity there nor is diabetes. Maximum divorces in US happen because of snoring. 40s to 50s and 60s बॉडी में बहुत सारे मेडिकल प्रॉब्लम आ गए, हमें मेडिकल प्रॉब्लम से निकलना है, whether it's diabetes, blood pressure, pressure on the hearts, and various other things. Our center is a center of excellence in metabolic and bariatric surgery. It's among the 2 centers in Mumbai and 10 centers in the country which are centers of excellence. Bariatric surgery is a keyhole surgery. We don't do major cuts. It is only 4 or 5 small holes. This is a blessing, life transforming surgery, life changing surgery, and it'll do a lot of good to people.
Hi sir, how are you feeling? Isn't this great? 6,200 kgs of weight operated. Did you get a chance to go through synopsis?
Oh yes,
Please take this.
I did. Yeah, thank you. I did go through the synopsis, but 6,200 kgs in a month. Patients have been operated, and I'm also happy that this has been a record of sorts. But I truly feel there's so much more we can do to the lives of people. When you consider the type of people whom we have operated in this month, what a relief it would be to them who were thinking that this is the end of life for them. So yes, I'm excited, but for different reasons. The numbers don't excite me so much, but the transformation it makes, that really excites me and pushes me to do more.
True, sir. So do you remember that patient Suraj? He came for consultation and he was worried that he has diabetes, so whether or not he could go ahead with the surgery.
Yeah, he and his entire family, this is now 2024, and in 2024, if the people come and ask us that can you do bariatric surgery in a patient who is a diabetic, in fact, they should be aware that in 2024, there are surgeries meant for diabetes, like the one anastomosis gastric bypass. We operated him for the bypass only, right?
Yes.
And these are surgeries for diabetes. And you are aware there are hundreds and thousands of patients who got operated for diabetes and obesity, and today neither is obesity there nor is diabetes. Though we always make it a point that we never tell patients that it is 100% going to go away. But yes, our experience, our data, our records show that I don't recollect even a single patient in the thousands of patients operated whose diabetes has either come back or has not gone away totally. I believe this is one of the finest surgeries, especially for diabetics who are obese.
Right. So in this month, how many cases of diabetes that we've operated?
Oh, I will have to see your data on this. So in this month, Yashvi, 72% of our patients who have been operated were diabetics, and your 13 patients were uncontrolled diabetics on insulin. So yes, 72% is not a small number, and this will definitely help them, because diabetes is a type of disease. It affects every organ of the body. It will affect your legs, your heart, your eyes, your kidney, your brain, your nervous system. So your arterial system, it causes limb gangrenes. So diabetes, if it can be eradicated or there is a remission, I feel this can be the best gift we can give to any patient.
Also, I've noticed that from OPD to OPD. So when we are doing our consultation, we are done with taking the history, preliminary history. After we bring the patient here, they are almost breathless. They hardly can breathe. They are here, even you must have noticed, they are here and they are breathless. So they are, worried that whether they can undergo the surgery, will they be able to handle that kind of pressure?
See, the fears are not ingenuine. The fears are very practical fears. People know that for bariatric surgery we have to give general anesthesia, and they are worried that if from your consulting to my consulting it is around 50 meters or 30 meters, 20 meters, and if in 20 meters the patient gets breathless, and when they come here either they are perspiring or they are panting and they cannot breathe well, they cannot speak to me till the time they don't rest for 20 seconds, this is not a healthy sign. But I'll tell you, for example, if a patient is say 5 feet height and the patient is 90 kgs, the ideal weight of that patient should be around 50 to 55 kgs and the patient is 90 kgs. That means we should not try to first of all distinguish that who is obese and who should require surgery. It's all based on BMI, not on the weight. Now if there is a patient who is 90 kgs and should be around 55 kgs, so he or she is 35 kgs overweight. So if you see, that patient's heart is providing blood to almost 2 patients and his or her lungs are providing oxygen to 2 patients. That means like you and I are sitting here and speaking to each other while carrying out these normal tasks of eating, sitting, watching TV, our heart and lungs are working at 2 times the potential. So what happens when there is a challenging situation like walking fast, walking more, climbing stairs? The heart and lungs can't live up to the expectations of body and they decrease their functioning capacity, and that brings breathlessness. So patient is not wrong if the patient feels that if I can't walk, then how will I sustain the surgery? But you are aware, Yashvi, that when patient comes to us for a surgery, have you ever seen me that a patient has come today and I tell you go and post the patient for surgery tomorrow? That is not the way we have to do it. Excellent pre-surgery protocol is what makes our institute, Astha Bariatrics, stand apart and also be called as a center of excellence. Protocols are very important. I don't think so we should reinvent the wheel every time, and we should go by absolute protocols, and these protocols suggest that the patient should have good breathing exercises before surgery, good spirometry before surgery, good protein diet before surgery, good liquid diet before surgery. If that happens, the patient's capacity to sustain the surgery becomes very high, the liver growth becomes softer, and I have a lot of ease when I'm operating the patient. And you will always accept one point which I say, that if I am comfortable during surgery, but naturally the patient will be comfortable after surgery. If I struggle during surgery because of any reason, the patient will have some struggles post surgery. So remember always, for every patient, you should have good protocols. In some patients, the protocols might be for 3 days, for some in 3 weeks, or in some patients 1.5 months. Don't shy away. We are not in a hurry to operate. They have lived through this obesity for so many years. For their health, to decrease the risk and get better results, of course, they can give a few weeks more.
Right. So one more case I wanted to discuss with you. Do you remember Prithvi Sambhare? He had obstructive sleep apnea.
The snoring guy.
Very high level of CO2, and after surgery in 1 week he's doing so well. I think you got a call from his wife, right?
Yes. So taking it on a lighter note, are you aware? I think so. I had shown you that paper which had shown that maximum divorces in US happen because of snoring. So, but people have to understand that snoring is the first point or where you come to know that the patient is going towards sleep apnea. Snoring is not just a sound of a flute, or a funny thing. It is the whistling of trachea. It shows that everything is not well. The oxygen that has to come in is not coming in the way it should come in. The carbon dioxide which should go out is not going the way it should go out. And you know what happens in every patient. Then they sometimes get up multiple times in the night because for passing urine. They snore too much. Daytimes goes so drowsy. So these are common things with sleep apnea, and then lethargy and decreased productivity. But yes, I remember that patient very well, and I got a call. I got a call from his mother, not from his wife. I got a call from his mother, and the mother said that माझा मुलगा आता चांगला झोपतोय रात्री, घोरायचा त्रास कमी झाला, means he stopped snoring. And 7 days or around 11-12 days, I think so. It's almost approximately 10 days plus, and he has already stopped snoring. He is sleeping well in the night, and till now he has lost only 7 kgs in the last 10-12 days. He would come down, I think so, from he was around 190, 180, 190 kgs. He would come down to around 80 to 90 kgs. Of course, 7 to 8 months time that we have planned for him. But yes, sleep apnea is obstructive sleep apnea is one of the most troublesome things. In fact, if you check your records, you will find at least not less than 300 patients of obstructive sleep apnea who used to snore have come to us after having accidents. You're aware of this?
Yes.
So they don't get good sleep at night and they are snoring. They get up again and again for passing urine. Some of them are on CPAP machine, but those who aren't on CPAP machine, they have daytime drowsiness. And so many of our patients, either on bike or in car, they've had accidents and then they've come here. That's the time they got to know that snoring is not just snoring, it is a sign of sleep apnea.
Yeah. Yes. So last thing I wanted to ask you, in this month, what was the lowest and oldest age that we've operated?
For that, I'll have to see your papers. So this is the age one, 17, 14, 13 years is the youngest patient that we've operated in this month. But I hope you are aware that we can't just decide for younger patients. But you know, in this month, if you see, we've operated almost 50% of our patients are 13 to 25 years of age. So we have to understand that there is something very important. One, when we decide about these patients, we have to see that the patient's body is mature enough to take the surgery. There are certain tests for that and we do those tests always. But we have one additional responsibility on our head. When we are operating patients of this age group, you know, majority of them are either unmarried or married and not yet had a complete family. So they are bound to have want their chance to have a complete family. So when we operate these patients, even for counseling, we should keep it in mind that we should always plan a surgery for them through which we are 100% sure that surgery will always be helpful for either getting married or for relations or for conceiving, having a child feeding. So you know, we can't operate on them the complex or bypass procedures. We have to operate the basic procedure with which not only they lose weight, they should lose weight without medical problems, without side effects, without complications, and they should get that opportunity to have a complete family.
Yes. And the oldest patient?
Oldest. This month the oldest was 71-year-old. And I remember this auntie who was 71-year-old. What a lovely lady and what emotional talk she had with me. So one thing that is very important again for this age group people. See, for every age group, you have your own priorities and the reason why you get operated. At the age of 13 to 25, of course 13 wala was used to get breathless and all, but usually this age group where they want to look better, enhance their personality, be more confident, being able to face the world, you know, because body shaming and all goes on a lot nowadays. But when you are in your 30s and 40s, the most important thing for people is that they want to stay fit, they want to stay healthy. 40s to 50s and 60s, it is that बॉडी में बहुत सारे मेडिकल प्रॉब्लम आ गए, हमें मेडिकल प्रॉब्लम से निकलना है, whether it's diabetes, blood pressure on the hearts, and various other things. But this lady specifically, you know, she came up to me and told me, डॉक्टर मुझे ऑपरेट कराने का सिर्फ एक ही कारण है कि मैं जिंदगी भर इंडिपेंडेंट रही हूँ, मैंने कभी किसी के ऊपर डिपेंड नहीं किया है, तो अब इस उम्र में मेरे आखिरी के सालों में मैं क्यों किसी पर डिपेंड करूं, तो मुझे ऐसे बनाइए कि मैं खुद उठ सकूं, अपनी चाय खुद बना सकूं, टॉयलेट खुद जाऊं, मैं बिल्डिंग में रोज 4 चक्कर लगाने जाऊं, मैं मार्केट खुद जा सकूं. So this was very inspiring. In fact, this inspired me that I should work a lot with her even pre-surgery and then post-surgery. And today it is what, only 2 weeks post-surgery and she starts going to market, she starts going out. A lady at this age. So this is commendable. It's not just about what we are doing. Your work, what you all do post-surgery, where you all do such lovely counseling, that also helps and boosts this patient's mind that yes, we can do something and there are people supporting us. So every age has got a different requirement and I will never forget this lady. She did brilliantly well.
Also, sir, if you must have noticed, in this month we've had a lot of international patients who after 2 months, 2 days of surgery, they flew back to their country. They did not have to stay. They were almost recovered, almost fully recovered, and they flew back.
See, Yashvi, the credit for this more than my surgery goes to y'all. Have we operated a patient that we counseled them on Zoom just 3 days back and they've come today? Y'all have spent a lot of time with them, counseling with them, telling them what are the pre-surgery protocols, what exercises they do, investigations are done beforehand. So y'all do spend a lot of time with them. But these numbers are only going to increase, Yashvi. See, you are aware that our center is a center of excellence in metabolic and bariatric surgery. It's amongst the 2 centers in Mumbai and 10 centers in the country, which are centers of excellence. So whenever an international patient goes on a search, they only search for a center of excellence because they know that these centers are professionally run centers. These centers are high volume centers. These centers are where protocols are there right from the time they enter hospital to the time they reach home. In fact, it's not like that. It's right from the time of the first consultation to I don't know how many years do you all keep following up with the patients, because I recollect now it's 10, 15 years also you all keep in touch with the patients. So when these patients are made to be aware that what are our expectations from them and we understand what are their expectations from us, and we align these two together, then patients always come in a positive mode. And you know that unlike Indian families and Indian patients where the entire family is there with the patient, international patients usually come alone, one person coming. Of course, it's good on your part that you all provide one doctor and one nurse for every patient separately who come from outside, but this helps them a lot in faster recovery. Surgery, the techniques, the technical expertise, the equipments, the instrumentation is so world class now at Asta Bariatrics that we know that from surgery point of view, there will be no reason why if I operate the patient in the morning, they would be taking 20-30 rounds by evening. Next day, they would go up and down the stairs. So usually this has been the way we work. Suppose a patient comes here on a Sunday, we operate on a Monday. By Tuesday night, they are back home. Yes, we do tell international patients that even if you're going home on Tuesday or leaving the hospital on Tuesday, don't go on Wednesday. Take one day more leave and go on Thursday. So yes, 2 to 3 nights is what they spend in the country. And I really feel you don't require more than that, because bariatric surgery is a keyhole surgery. We don't do major cuts. It is only 4 or 5 small holes, or sometimes one hole, or sometimes robotic. So we don't do any damage that the patient should not be able to walk or move around or even join work within 2 to 3 days. So I think this is a blessing, life transforming surgery, life changing surgery, and it'll do a lot of good for people.
Yes, so that is it. Thank you so much. It was lovely to get all the doubts cleared, to talk about these cases. So
My pleasure.
Thank you so much.
And congratulations for the amazing work done in this month after month, month after month,
Yes,
month after month.
definitely.
It was my pleasure to be working all with you.
Thank
Thank you.